Deadly virus is making headlines again, and health experts around the world are watching closely. The World Health Organization has now declared the recent Ebola outbreak in Central Africa a global public health emergency after hundreds of suspected cases and rising deaths were reported in the Democratic Republic of Congo and Uganda. But what exactly is Ebola? How does it spread? Why is it considered one of the deadliest viruses on Earth? And should the world be worried right now? In this video, we're breaking down everything you need to know about Ebola virus disease, including symptoms, warning signs, complications, transmission, prevention tips, and the latest updates from the 2026 outbreak. Watch until the end because some early symptoms can look just like the flu, but rapidly turn life-threatening. Ebola virus disease, often simply called Ebola, is a rare but extremely serious viral infection that can cause severe bleeding, organ failure, and death. It belongs to a group called viral hemorrhagic fevers. The virus was first discovered in 1976 near the Ebola River in what is now the Democratic Republic of Congo. Since then, multiple outbreaks have occurred, mostly in African countries. Ebola is notorious because of its very high death rate. Depending on the virus strain and access to medical care, outbreaks can kill anywhere from 25% to 90% of infected people. The current 2026 outbreak involves the Bundibugyo strain of Ebola, a rare type for which there is currently no approved vaccine or specific treatment. Health officials say this makes the outbreak especially concerning. Unlike airborne viruses such as COVID-19, Ebola spreads mainly through direct contact with infected body fluids. But once transmission begins in communities or hospitals, outbreaks can grow very quickly. Ebola spreads through direct contact with blood, vomit, saliva, sweat, urine, feces, semen, or other body fluids from an infected person. The virus can also spread from contaminated needles, medical equipment, bedding, or clothing. One important fact is that a person usually becomes contagious only after symptoms begin. That means someone without symptoms generally does not spread Ebola. The virus can also spread during funeral practices if people touch the body of someone who died from Ebola. In fact, unsafe burial practices have contributed to several major outbreaks. Scientists believe Ebola originally comes from animals, especially fruit bats, and can spread to humans through infected wildlife. Healthcare workers are also at high risk if proper protective equipment is not used. During the current outbreak, multiple healthcare worker deaths have already been reported. One reason Ebola is dangerous is because the early symptoms can look very similar to common illnesses like the flu, malaria, or typhoid fever. Symptoms usually appear between 2 to 21 days after exposure. Early symptoms may include sudden fever, severe fatigue, muscle pain, weakness, headache, sore throat, chills, and loss of appetite. As the disease progresses, symptoms become much more severe. People may develop vomiting, severe diarrhea, stomach pain, skin rash, red eyes, chest pain, difficulty breathing, bleeding from the gums or nose, and blood in vomit or stool. Not everyone develops dramatic bleeding, but internal bleeding can still occur. The virus attacks multiple organs and damages blood vessels, leading to shock and organ failure. Without rapid medical care, Ebola can become deadly very quickly. Complications may include severe dehydration, liver failure, kidney failure, massive blood loss, septic shock, brain complications, and multi-organ failure. Some patients die because their immune system becomes overwhelmed. Others develop dangerously low blood pressure and collapse into shock. Even survivors can suffer long-term health problems for months or years. These may include joint pain, vision problems, eye inflammation, hearing loss, fatigue, memory difficulties, and mental health problems. In some cases, the virus can remain in certain body fluids for months after recovery. Doctors diagnose Ebola using specialized laboratory tests that detect the virus. Because symptoms resemble many other infections, early diagnosis can be difficult. During the current outbreak, health officials reported testing shortages and delays, which may have allowed the virus to spread unnoticed for weeks. There is no simple cure for Ebola. Treatment mainly focuses on supportive care, including intravenous fluids, oxygen support, blood pressure management, treating infections, replacing electrolytes, intensive medical monitoring. Early treatment greatly improves survival chances. For some Ebola strains, approved antibody treatments and vaccines exist. However, the 2026 outbreak involves the Bundibugyo strain, which currently has no licensed vaccine or targeted therapy. Researchers are now studying experimental antiviral drugs to help control the outbreak. Preventing Ebola relies heavily on infection control and public awareness. Key prevention tips include: avoid direct contact with infected body fluids. Wash hands frequently. Avoid handling dead bodies without protection. Use proper protective equipment in healthcare settings. Isolate infected patients quickly. Follow public health guidance during outbreaks. Travelers to outbreak regions should also avoid contact with sick individuals or wildlife. Healthcare workers must use strict infection control procedures because hospitals can become major transmission sites if safety measures fail. Community education is also critical. During outbreaks, fear and misinformation can make containment much harder. Ebola remains one of the world's most dangerous infectious diseases, but outbreaks can be controlled with fast action, medical support, and public awareness. Knowing the symptoms early and understanding how the virus spreads can help save lives. If you found this video helpful, make sure to like, subscribe, and share this with others so more people can stay informed. And remember, accurate information can be just as important as medicine during an outbreak. Thanks for watching.